Namaste and Siddhi Pranam. Welcome to your today's topic, the phases of fetal development. So, the fetal development is a very important subject to really understand what stage the mother is currently standing on, especially when you're introducing prenatal yoga to them. So prenatal yoga is an excellent way to prepare for childbirth and support the health of both the mother and the developing fetus. So as a teacher, it's really essential to have an understanding of the process of fetal development, to be able to guide the mother effectively throughout her yogic journey with you. So we can really emphasize the importance of practicing safe yoga through every step of the way to the mothers. And it's essential that we understand the stages, and it's essential that able to communicate to that mother if at all required and whenever required. Because we are not all science experts, we don't know the real development, what biologically and emotionally and mentally the baby is going through. And once you understand that and how critical it is to maintain an inner and outer environment which is not only safe but also healthy in all manners for the fetus, so that will be really crucial, not just for you to understand but for you to be able to communicate to the mothers whenever required. So the process of fetal development can be really divided into 3 stages. The first is the germinal stage, second is the embryonic stage, and third is the fetal stage. So each stage is characterized by unique changes in milestone, which are essential that we understand what changes are occurring in each stage of the fetal development. So let's discuss the first stage, the germinal phase. The first stage of fetal development is germinal stage, which begins at the conception and lasts around 2 weeks. So during the germinal stage, the fertilized egg begins to divide rapidly and forms blastocysts, which is the cluster of cells that we have discussed earlier also. So the blastocyst then implants itself into the uterine wall, where it will continue to develop into a fetus. So the blastocyst consists of 3 distinct layers of cells that will eventually develop into the different structure of fetus. These layers are the endoderm, mesoderm, and ectoderm. The mesoderm will develop into the digestive and respiratory system, while the mesoderm will form the bones, muscle, and circulatory system. The ectoderm will eventually develop into skin, nervous system, and sensory organs. So during the germinal stage, it's crucial for the pregnant woman to maintain a healthy lifestyle that supports the fetal development. This also includes avoiding harmful substances like alcohol, tobacco, drugs, etc. So pregnant women should also prioritize, a balanced and a nutritious diet that really supports the fetal development at this stage and during the all stages, of course. So if you understand the criticality of each phase, you would know that what is really suitable for this stage. So for the germinal stage, what practices are suited is more kind of gentle yoga posture that promotes relaxation and reduce stress. Those kind of practices, including yoga nidra meditation, that focuses on reducing stress and inducing relaxation. This can be really helpful during this phase of germinal phase. Also, you can use a lot of relaxing pranayama at this stage for the women to manage any kind of stress and anxiety and release excessive stress consistently from the body. So if you introduce daily pranayama practice, or sometimes if they're practicing twice a day, introduce only pranayamas, those are calming in effect, that can really help relaxation at this stage. So the next stage is the embryonic phase. So this is the second stage of fetal development, which starts in the 3rd week of pregnancy and lasts until the end of 8th week. So during this embryonic stage, the major organs and structure of the fetus really form. So that also makes it a very critical stage in the fetal development phase. So the 3 layers of the cell that form during germinal stage now develops into specialized tissues, organs, and systems. So throughout the embryonic stage, several significant milestones also occurs. So first is the neural tubes forms and closes, so which will eventually become the brain and the spinal cord. The heart begins to beat in this phase. The circulatory system also forms. The circulatory system starts to provide nutrients and oxygen to the developing fetus. Limb buds also begins to form, which is eventually they will become arms and legs. And the eyes, ears, nose starts to take shape in this phase. The digestive and respiratory system also begins to develop in this phase, setting up a very good foundation for healthy breathing and digestion. So it's really essential that we avoid any posture that involves twisting or compressing the abdomen at this phase, and that can really put any pressure to the fetus. And mothers should actually avoid any movements that can cause strain and discomfort at this phase specifically. So they should start to be more alert during this phase. And we can always use pranayamas, calming effect like releasing anxiety, and visualization practices of growth and expansion, and bringing a lot of creating a energetic environment of blessing the child to grow healthily. All those meditation practices can be introduced at this stage to manage the overall well-being of mother and the child. And you can continue to suggest mothers to opt for healthy lifestyle during this phase also. Now the next phase is the fetal phase, where the fetal stage is the last and the longest phase of the fetal development, beginning at the end of the 8th week of pregnancy and lasting until birth. So during this phase, the fetus grows and develops at a remarkable pace, gaining weight and becoming more functional. The fetal stage is a time of tremendous growth and development for the fetus, and during this stage, the organs and the systems of the fetus continues to mature and become more functional. So the fetal stage is a time of rapid growth, and fetus gains a significant amount of weight at this point in time. So one of the most notable development during this stage is the rapid growth and development of the brain. So the cerebral cortex, which is responsible for the higher brain functions such as thought and reasoning, begins to form during this. The fetus also becomes more responsive to the external stimuli such as lights and sound in this phase. The lungs also develop rapidly during fetal stage and begin to produce surfactant, a substance that helps the lungs to expand and contract. So surfactant is the substance which helps in expanding and contracting for the lungs, develops during this phase. This is an important milestone also in a manner that it enables the baby to breathe after the birth. So all the functions that are required to breathe also forms in this phase. The digestive and the urinary system also becomes fully functional during the fetal stage, allowing the baby to digest and eliminate waste products at this point in time. Additionally, the skeleton continues to ossify or harden, and bones become more muscular. During the fetal stage, the fetus also becomes more sensitive to touch and can respond to stimulation. So this is a time when the fetus may begin to move more frequently and vigorously. So it's actually a very crucial time for the growth and development of the baby, and it's really essential to have all the kind of precautions and to continue healthy lifestyle, balanced eating, and avoiding any harmful substances throughout this phase also. And this phase requires the mothers to take plenty of rest whenever required, and avoiding any kind of excessive stress or anxiety or any physical pressure, any physical activity that puts kind of pressure on their abdomen or restrict blood flow in any manner. That all should be avoided in this phase. So now let's discuss the development of fetus trimester-wise. So we really should have a kind of thorough understanding of development throughout the pregnancy, which begins from the first day of woman's last period or menstrual day. And so even though fetal development does not start until the conception, this is because the female body is really preparing for pregnancy during each menstrual cycle. So the pregnancy can actually be divided into trimesters, which typically last around 12 to 14 weeks of each phase. So, however, trimester calculations may differ, depending on the method used. So, different countries have different way of calculating it, but it is more or less similar. One trimester is usually 12 to 14 weeks. So for ease of understanding, what we can do is we can divide it into 3 trimesters, or we can take it as understanding of over 3 months, around 3 or a little over 3 months each trimester lasts. So the first trimester starts from week 1 and ends at the week 13. The second trimester usually ends around 26th week and comprises the 4th, 5th, and 6th completed months of the pregnancy. And the third trimester, on the other hand, can end anywhere between 38th and 42nd week of the pregnancy, and includes the 7th, 8th, and 9th completed months of the pregnancy. So understanding the timing and the stages of pregnancy is really critical, as we have to tailor the instructions that mother needs to receive for the yoga practices. So let's understand about the first trimester. Okay, so the first week to the second week, and the first 2 weeks of gestational age occurs during a woman's menstrual cycle as her body prepares for ovulation. So typically ovulation occurs approximately 11 to 21 days from the first day from her last period. So during intercourse, hundreds of millions of sperm are released in the vagina, and they travel through the cervix into the fallopian tube, and the conception occurs. The sperm then fertilizes, eggs forms a zygote, which consists of a single set of 46 chromosomes and serves as the basis of the new human being. Zygote consists of 46 chromosomes serving as the basis of the new life. So then the fertilized eggs, also called as morula, spends a couple of days moving through the fallopian tube towards the uterus, where it further divides into a multicellular being, blastocyst. So then blastocyst will eventually implant itself in the uterus lining, and that typically takes between 6 to 12 days after the conception. So that begins the embryonic stage. So it is during this period that the embryonic disc forms and divides into the 3 layers which will eventually develop into various organs and tissues. Now, once that has passed, we enter into week 3, and this week 3 of gestational age corresponds to the first week of the fetal development, and the embryo undergoes significant growth of brain, spinal cord, heart, gastrointestinal tract begins to develop during this phase. And this period is marked as initial stage of these basic structure. In week 4 to 5, the gestational age progresses to where we come into kind of advanced growth stage. So although fetus, if you look at in the picture, will not be recognizable, but arms and legs and buds are actually now developed and can be seen slightly. So the heart also starts to beat steadily, and the placenta also has begun to form during this period that begins to produce hormones such as HCG. Also, the blood flow is observed in the main vessels during this phase. So the blood flow starts to come to the baby's body at this stage. The early stages of eye and ear formation can also be seen here in these weeks. And by the end of these weeks, the embryo is approximately like 1/4 inch in length. Now then comes week 6. At the gestational age of 6 weeks, which marks as like kind of 4th week of fetal development, significant changes occurs in the embryo. The formation of lungs, jaw, nose, and palate commences at this stage, while the buds of hands and feet exhibit webbed kind of structures that will later develop into fingers and toes. And additionally, at this point, the brain continues to develop and mature into its complex part. If a vaginal ultrasound is conducted during this period, it could be potentially able to detect the audible heartbeat of the embryo. At this stage, the size of embryo is about 1/2 inch in length, indicating the gradual growth and development. So in short, we can say that 6-week gestation, in the 6 weeks of this gestation period, the fetus undergoes several essential development milestones that sets the foundation for further growth and maturation. Then comes the week 7th. So during the 7th week of gestation, which marks as the 5th week of fetal development, the crucial changes occurs in the embryo. So despite the weight is less than a tablet of aspirin, every essential organ in the tiny body has started forming at this stage. At this stage, the hair and the nipple follicles begin to form, and the eyelids and the tongue commence their formation process as well. Moreover, the elbows and the toes also become prominent as the trunk of the embryo straightens out. So these changes indicate that the gradual development of the fetus, even though it is still in the early stages, but it's happening at a rapid pace. At 7 weeks, the embryo's body undergoes significant development changes, including formation of critical organs and emergence of visible physical features. So these milestones highlight gradual progression of fetal development and set a foundation for further growth. At week 8 to 13, which marks as the 6th week of fetal development, the external and internal formation of ears continues. All the structures present in an adult humans are now present in a tiny embryo, and the bones also start to form at this stage. The muscles also can contract, and facial features also continue to mature in this phase. The eyelids becomes more developed as the embryo reaches the end of the embryonic period and enters the fetal period. The size of the embryo is about 1 inch long, equivalent to size of a bean at this stage. What a miracle of life. So between 9 to 13 weeks, which marks as like around 7 to 11th week of fetal development, the fetus grows to approximately 3 inches in length and weighs around an ounce. So the genitalia or the genital parts are now clearly formed for the male or female, but may not be visible on the ultrasound scan at this stage. So the eyelid also begin to close and will remain shut until 28th week of pregnancy. Furthermore, the fetus can make a fist and the buds for the baby teeth begin to appear. The head is nearly half a size of the entire fetus. This development changes in the fetus during 9 to 13 weeks highlight the rapid growth and maturation process. So at this stage, the fetus starts to resemble a human basically, and its features become more defined. The closure of the eyelids is a significant milestone that protects the developing eyes from external factors. So in summary, I would say that 8 to 13 week of gestation period, the fetus undergoes several essential development changes, including formation of various organs, growth of limbs, emergence of physical features, and these changes are crucial for gradual progression of the fetal development that sets a very beautiful foundation for the next phase of development. And what we can assure is that during the phase, we really need to avoid harsh or strong movement, even though nothing physically is visible on the woman's body, but a life is growing inside her, and hence it becomes very crucial for us to avoid any rapid damaging movements to the mother's body. Now let's jump into the second trimester and the development that occurs during this phase. So during the gestational period of 14 to 16 weeks, the fetal development during the week the fetal development is around 12 to 14 weeks now, and the skin of the fetus becomes very transparent at this age, and a fine hair known as lanugo starts growing on the head of the baby. The fetus also starts sucking and swallowing small amount of amniotic fluid at this stage, and fingerprints which are unique to human beings begins to form on the tiny fingers of the fetus. Additionally, meconium is produced in the intestinal tract, which will later become the baby's first bowel movement. The mother may also feel flutters in her growing abdomen as the fetus becomes more active and moves around. The sweat glands have also developed, and the liver and the pancreas produce fluid secretion necessary for the growth and development of the baby. At this stage, the fetus has reached the length of 6 inches and weighs around 4 ounces. And these developments are very crucial as they prepare the fetus for the future growth and development in the womb. So the growth and the maturation of the different organs and systems are essential for the healthy development of the baby. And while these developments are exciting, it is essential to monitor the pregnancy closely to ensure that the mother and the baby are healthy and progressing well. And at the week 17 to 20, at this particular stage, the baby's movement becomes more noticeable to the mother, and the growth of eyebrows, eyelashes, and the tiny nails on the fingers and toes can also be seen during this phase. the fetus skin undergoes various transformation and starts producing the substance known as vernix at around 20th week of gestation. So vernix is basically white pasty material that forms a protective covering over the fetus or the baby's skin. It guards the baby against the amniotic fluid. Additionally, the fetal heartbeat can now be heard using a stethoscope. So if the mother's, if we put a stethoscope on mom's stomach, we can really hear a tiny, tiny heartbeat present there. At this stage, the fetus kind of measures around 8 inches in length and weighs roughly 12 ounces. Then comes the week 21 to 23, and at this point, the fetal development, the entire body is now covered with lanugo, and the skin is becoming less transparent as the fat begins to accumulate, giving the fetus more an infant-like appearance. The eyes are fully formed with all their components in place. The liver and the pancreas are also in the process of developing, working hard to fulfill their ultimate function. So in terms of size, fetus now reached a length of around 10 to 11 inches and weighs about 1 to 1.4 pounds. Around now week 24 to 26, with the aid of medical technology, a baby born at present would have this ability to survive. If the baby is actually born during this phase, unfortunately, then now we have medical instruments at place to make the baby survive. The developing fetus has established now it has its own patterns of sleeping and walking, which the mother may become aware of eventually. Additionally, the fetus has now developed a startle reflex, and the air sacs in the lungs are beginning to take shape. Over the next few weeks, the brain will undergo rapid development, and the nervous system is now mature enough to regulate some bodily functions. And at this stage, the fetus has reached a length of approximately 14 inches and weighs around 2 pounds. Now, let's come on to the third trimester. So the third trimester, beginning from the week 27 to 32, during this upcoming weeks, the developing fetus undergoes significant growth, with the body becoming more rounded as fat is stored. And by 32nd week of pregnancy, the fetus typically measures around 15 to 17 inches in length and approximately 4 to 4.5 pounds. Although the lungs are not fully matured yet, the fetus engages in rhythmic breathing movements. While the bones are fully formed, they remain soft and malleable at this stage, allowing for a safer delivery. In addition, the fetus really stores its own calcium, iron, and phosphorus to support its growth and development at this point in time. And at this stage, the eyelids that have been closed since the end of the first trimester opens, allowing the fetus a sense of light and darkness. So the visual system is still in its early stages of development, but the fetus can detect changes in brightness and movement at this point in time. The nervous system continues to develop, with the brain becoming increasingly complex at this point, and the fetus can now distinguish between sounds, and its sense of taste is also beginning to develop as well during this time. As the pregnancy approaches the end of third trimester, the fetus is nearly fully developed and is ready for life outside the womb. However, some important development milestones are still to be reached, such as final maturation of the lungs, and with the aid of advanced medical technology and proper care during pregnancy, most babies are born healthy and thrive in their first months of life. Week 33 to 36 now, at approximately this stage of development, the fetus typically descends into the head down. It goes and takes the preparation and prepares for the position for birth, basically. And the rate at which the fetus gains weight is increasing, and it is currently going through a phase of rapid weight gain. The hair known as lanugo, which has covered the skin, is starting to disappear, and the skin itself is becoming smoother and less wrinkled. At this point in the pregnancy, the fetus has grown significantly and measures between 6 to 19 inches in length, and it now weighs between 4.5 to 6.5 pounds. With further weight gain expected in the final weeks leading to the birth, the organs are functioning well, and the nervous system continues to develop, and the brain becoming more advanced. The eyes are fully formed, and the fetus can distinguish light and dark, although the color vision is not yet fully developed. The fetus has now reached a point of maturity where it can regulate its own body temperature and produce hormones which are necessary for the survival outside the womb. The lungs are almost fully developed and capable of breathing their own, though a few weeks of maturation will still remain at this point in time. As the pregnancy approaches to its final stages, the mother will need to take extra care of her health and continue to monitor baby's movement and development with regular checkups and ultrasound. And with proper medical care and assistance, the baby is likely to be born healthy and ready to embark on the journey of life. Now comes the week 37 to 40, and by the 38th week of pregnancy, the developing fetus is considered full term and can arrive any moment. The uterus now becomes increasingly crowded. The mother may notice decrease in fetal movement. The fingernails have grown to a considerable length, and they will require trimming right after the birth. And it is worth noting that both male and the female babies will have tiny breast buds at this point. And during this stage of development, the mother continues to provide the fetus with antibodies that help protect against any illnesses or diseases. Now all the organs are fully developed, and the lungs continue to mature until the day of delivery. The fetus is now approximately 19 to 21 inches in length and may weigh anywhere around 6.5 to 10 pounds. And the exact weight varies on factors such as genetics and mother's diet and health during the pregnancy. So it's really varies on various factors. And as the pregnancy nears its ends, the mothers should be prepared for the onset of labor, which can occur at any point in time during this phase. Now, regular prenatal checkups and monitoring of the fetal movement can really help and ensure the safe and healthy delivery. And the health care provider or the doctors will likely advise the best course of action for the mother's and the baby's health, as well as the baby's position in the uterus at this stage, and what kind of delivery method would be required will be guided at this stage. So with women whoever is taking the proper medical guidance can, in most cases, the babies are actually born healthy and they are ready to embark the journey outside the world. Now, let's quickly review, very, very basic precautions during each trimester. So let's begin with the first trimesters. So the precautions has to be taken during pregnancy to really, ensure the health and safety of the developing fetus. So the first trimester precautions would be just basically to maintain a healthy diet, and it's really essential to eat a well-balanced diet during pregnancy, and have variety of foods with you that enriches the mothers with variety of vitamins and minerals, and she should really eat foods that are rich in folic acid, iron, calcium at this stage. And the second, what she needs to really do in the beginning of the pregnancy itself, if she is consuming alcohol or any other toxic substances, she needs to stop immediately because it really harms the development of the fetus. Third would be avoiding foods such as raw or uncooked meat, fish, eggs that can carry bacteria which can really be harmful for the baby. And even if the meat is consumed, then one needs to ensure that it's cooked very, very thoroughly. Fourth would be starting to take prenatal vitamins. And prenatal vitamins are really essential during the first trimester, as they help to ensure that the mother and the fetus are getting necessary nutrients. And next is getting plenty of rest. So the first trimester is the time of rapid development of the fetus, and the mother body is also undergoing significant changes. So it's really essential that the mother does not overexert herself and gets plenty of rest. Now, coming on to the second trimester, just continuing a healthy diet, well-balanced eating, increasing calorie intake will also be required at this point in time as the baby is growing. Necessary amount of movement or exercise is really beneficial at this stage, and avoiding any high-impact workouts though, but just gentle movements like yoga or swimming and slight walking will just be helpful. In this stage, the sleep becomes very essential and critical, and sleeping on your side, or preferably on the left side, really improves the blood flow to the baby. Fourth is that we have to be aware of signs of any complications of the stage, and watch for signs such as bleeding, cramping, excessive discharge, if all these signs, any of it is being seen, then you need to really contact the doctor immediately. Staying hydrated at this stage also becomes quite critical, and drinking plenty of water really helps prevent any kind of complications to the pregnancy. Now, let's move to the third trimester. So the third trimester, we obviously need to continue eating a very, very healthy diet, well-balanced diet, and increasing the calories as much as per the requirement of the mother's body. Usually, like for example, I'll give you a quick understanding on increasing the caloric intake. So if the mother used to have a 1500 calorie diet prior to being pregnant, each trimester she can increase about 200 calories. So by the time, let's say, she reaches third trimester, she should consume around about in between 2200 to 2400 calories, because we are increasing around 200 to 300 calories with each trimesters. So it's not like that she has to eat for two, which is a very common notion. She just have to increase slightly with the growing baby. So just about, let's say, one half of 50% more extra diet than she was taking. Now, exercise also is still beneficial in third trimester, and essential to really take a lot of precaution at this stage and avoid any rapid activities that can be harmful. And the regular prenatal checkups becomes quite essential at this stage, and to detect any potential complications in time. And monitoring the fetal movement also becomes very much critical at this stage, and the mother should also be should also stay aware of fetus movement and contact the doctor if she if she notices any changes in the fetus movement and feels that the baby is not moving. And this stage also marks us preparing for the childbirth, and the third trimester is really a good time when she can take childbirth classes or create a birth plan and pack a hospital bag. That's what a preparation looked like. But also use all the yogic tools like meditation and yoga nidra to prepare herself mentally, emotionally, and physically for the birthing day. With that, thank you for going through this journey with me. I really hope this was helpful. See you in the next chapter. Thank you. Namaste.